The Home Health Aide Competency Test. Once training is completed, you will be required to complete a competency test to ensure you can properly perform tasks as required for their patients. Without additional or advanced training, advancement within the field is very limited. Most likely, you will be working for a home healthcare agency, either that or you're self-employed. Once you have the training, passing the competency evaluation should not be difficult at all. The competency test will cover a wide area of disciplines within home health care. In some states, you may be required to be a certified nursing assistant before you're a home health aide. You can do this. You've done it before, and you can do it again. Since you were in grade school, you were taking tests or quizzes of some sort. Passing an exam is simply a way to demonstrate that you're knowledgeable in a subject matter. Simple, right? So relax. Preparing for, taking, and passing the Home Health Aide test is just like any other. Granted, subject matters you weren't exposed to in grammar school. Home Health Aide test questions will test your knowledge about what you've learned about taking care of clients in their home. When you walk into a client's house for the first time or the 100th, you should have the skills to help and care for that person. That's what home health aides do. You've gone through the training and are ready to take the exam and conquer the world in your new career. But where do you begin? Focus on preparing for and taking the exam and avoid all the noise you may hear and see regarding the exam. Start by doing a little planning. Once you have a date and time to take the test, you can back into the planning for it. The test is usually divided into two sections, written and skills. You will take both on the same day. Very seldom these two can be taken separately. Most candidates find this easier rather than having time between the two, so please plan accordingly. Be flexible. Life gets in the way. We all have very busy and hectic lives. You must be and remain flexible. There are a lot of things that need to come together for you to take the test. For example, sometimes there's a delay at the testing place. Sometimes unforeseen circumstances cause test results to be released late. Go into this whole process expecting to be flexible. The earlier you can start planning things, the smoother it will likely go. Don't procrastinate. Procrastination is a natural human condition and can hit you at any time. Back away from social media. Each time you check a message, you're wasting valuable study time. Find your study space. Your atmosphere can really affect how effectively you study. Get a study buddy. Ask your buddy to check your progress and make sure you stay on the right track. Fall into a routine. Set aside blocks of time during the day devoted entirely to your studies. Aim for the moon, settle for the stars. Focus on chipping away at a subject matter at a time. Learn at a steady pace and don't be hard on yourself. You'll do great. Please realize, too, that everyone is different. Your study habits are unique to you and you alone. Start from the end and work forward. Take the time in the very beginning to plan out the whole process. Start by writing down dates and deadlines. When is the test and what time do you need to be there? Enter these on a calendar, even your smartphone, and set reminders as well. Now work your way back for the test day. You'll probably want to give yourself a week to study and review the material. Chances are you received your training from a home health agency. Set up some time with the program coordinator and review the steps to get certified. Did you complete your training online? Same thing. Give them a call and try to have a meeting, even by phone. Ask them what other students have done to prepare for the test and what resources they may have available that you could use. If you find a subject matter especially difficult, try to make flashcards, review the vocabulary terms, and ask the training folks for resources such as additional books or videos. The best advice of all is right here. Take as many practice tests as you can, period. There are many benefits to taking practice tests. The most obvious benefit is that it increases your learning to help reinforce what you've learned and helps with what you may need more assistance on. Home health aides who take practice tests have a much better chance of passing the test on the very first try. Remember that. The more tests you take, the better your chances of passing. The reason is that knowledge and skills increase from taking these tests simply because you're practicing what will be on the real test. Practice tests have questions from the very test you may be taking, and seeing them before will help alleviate much stress on test day. Besides, you'll become familiar with different question formats. Some questions may be multiple choice and others be fill in the blank. The most popular format is multiple choice and taken on a computer. The best part? You receive immediate feedback on your knowledge so that you can better focus studying. If you get anxious or nervous just thinking about the test, by the time a real examination rolls around, you will be eager to show what you've learned. Take as many practices as you can get a hold of. It relieves any stress you may have now or will have on the day of the actual exam. If you're familiar with what it looks like, how the questions flow, and how to best manage your time, then you will be virtually stress-free when you take it on exam day. I'm asked many times on how to find practice tests. The first suggestion I make is to tap into who provided your training. They're used to folks asking for practice tests and almost guaranteed they have a bunch on file for you to take. Take as many tests as you can get your hands on. Many, if not all, will be free, so why not? Remember, everybody wants you to pass the exam. No one's trying to stop you in your tracks and prevent you from being a certified home health aide. They just want to make sure you know what you're doing and you have the proper skills. People will help. All you must do is ask. There are books available that won't cost you much, and there are online tests as well, though most will be hitting you hard to purchase something. And that's okay. Just be careful and don't purchase something you really don't need, and be especially cautious of monthly payment plans. Here are some study tips for the test. Have you ever thought of studying with friends? Your friends can help you prepare for the Home Health Aide exam, and they will help as they'll want you to do well. Ask your friends and family to remind you to study, or give you short quizzes or flashcards, or even just have them sit and listen while you explain something you've learned about being a home health aide. Studies have shown that talking through a process out loud has been proven to improve your ability to remember it. Having a conversation about a key concept will cement the knowledge in your brain. Studying for the competency test in a group setting can be a very positive way to prepare. Many students find that it's more enjoyable to study with a few classmates rather than studying alone. Study groups make you feel more comfortable to ask questions or sort out difficulties with a friend, and teaching to other members of your group can help you to strengthen your own understanding of the subject matter. Besides, others in your study group may have ideas and study habits that you've not thought of and can use yourself. And don't forget about practicing some of your required skills. Make sure in either your study groups or one-on-one with a fellow classmate, you talk about what you're studying and demonstrate to them some of the skills you're trying to master. It sort of forces you to put your best foot forward. Set aside time to demonstrate several home care skills with a friend. Tell them exactly what you will be doing and why. Then perform that skill on them. For example, help them transport from a chair to a bed and then back. No need to be silly about this. Treat as though your testing registered nurse is watching and grading you. Keep practicing the skills and talking out loud, and you will master all the components of the test. This applies even for the skills that you learned in the clinical section for your home health aide training. Practice these, including recording vital signs, dressing client, transfer to, from the bed, etc., clinical skills on your spouse or a friend. You can also call your home health aide training coordinator and ask if there are past students you can speak with. Many of these facilities have a list of referrals for just that purpose, so take advantage of it. When getting in touch with former students, ask away. Ask her what to expect on the multiple choice questions. Ask if she had enough time and how to best manage time throughout the test. Ask her what she found the most difficult, etc. Exam Outline. Home health aides are selected based on such factors as a sympathetic attitude toward the care of the sick, ability to read, write, and carry out directions, and maturity and ability to deal effectively with the demands of the job. Generally, training programs must address each of the following subject areas through classroom and supervised practical training, totaling at least 75 hours, with at least 16 hours devoted to supervised practical training. The individual being trained must complete at least 16 hours of classroom training before beginning the supervised practical training. Here are some typical subject areas: communication skills, observation and reporting of patient status, basic infection control, elements of body functioning, maintenance of a clean, safe, and healthy environment, recognizing emergency procedures, safe techniques in personal hygiene and grooming, toileting and elimination, safe transfer techniques, normal range of motion and positioning, adequate nutrition and fluid intake. Of course, all this varies by state, but this is the very least you need to know and can be assured you will see most, if not all of this, on the test. The exam outline. The home health test is separated into two main parts: written knowledge test, skills set test. If you fail either part of the exam, you may reschedule to take the exam at the next available test date. If you fail the written test but pass the skills test, then you must repeat the written test only. If you fail the performance test but pass the written test, then you'll be required to repeat the performance test including all skills. More about the written knowledge test. The written portion normally consists of close to 100 multiple-choice questions. Most exams have an average of 75. Approximately 2 hours will be allowed for the written portion of the test. The instructor will periodically let you know how much time is left so you can plan accordingly. With 15 to 20 minutes left, you should be on your way to finalizing the exam. Depending on the testing center, there may be a provision to take the test either written or orally. When you schedule the test, ask about the testing options, especially if you have a reading difficulty. Helpful, too, if English is your second language. Here's an approximate breakdown of content of the multiple-choice questions: client rights, first aid and emergency measures, client observation, employability skills, client care, safety, nutrition, positioning, transfer of client, personal care, home maintenance, child care, medications. Tips for preparing for the written knowledge exam. Take notes, make flashcards, doodle drawings to help jog your memory. Do not wait till the last minute and try to jam it all in the night before. Get a good night's rest before the test. Be familiar with the test directions. After you've finished the test, review your answers. More and more testing centers are offering the option to take the test on a computer. Rest assured you do not need any coding or programming experience. Trust me. Instructors have made it very easy to take the test on a computer. You'll find it very easy. Before you start, you'll be given a real quick tutorial on how to use the computer, what keys to use for what, and how to review your answers. You may be given sample questions you can practice too. One of the many benefits of taking the test this way is that once you submit the test, you will know right away your score and if you've passed. Now on to the skills set test. Here's how to prepare for the skills set test. While in your training, take every single task seriously and practice them again and again. These are the same skills that will be on the test. If you have a question or want further explanations, ask your instructor. This is why she's here. It's better to need help in training than when it's time to take the test, when you won't be able to get assistance. You can ask your instructor which skills will be on the test or if there's a practice test that you can take. Some skills on the test may include hand washing, making an unoccupied bed, changing an occupied bed, changing the position of the patient, taking vital signs, and so on. Please note, chances are very good that you will have to demonstrate 3 to 6 skills during the test. Practice your skills. Ask friends or relatives to pretend to be a patient so you can sharpen your skills. This is something you can do as you learn hands-on skills in your training. The more practice, the less you'll be stressed on test day. Perform the skills exactly how it was taught. Learn how to perform each task with the same basic steps. Listen to the instructions. Don't assume you know what the instructor is going to say before he or she says it. Listen very carefully to the instructions given. This is not the time or place to be shy, so please ask questions if something is not clear to you. Preparation is the absolute key for building your confidence to acing the test. You may have been bored or daydreamed in your training classes, but those classes and sessions were all designed to help you be a certified home health aide. On to test day. The skills exam portion is just that, the skills you learned in your clinical setting. You may be asked to demonstrate proper hand washing, taking blood pressure, transferring a patient to or from a bed, etc. Many times there will be a certain number of mandatory tasks to perform, then you have your choice of several others to complete. You're normally tested on 5 skills and give about 30 minutes to complete all of them. This portion of your evaluation will be in a setting that will look very much like a real-life work setting. It will normally contain a bed, chair, wheelchair, sink, and bathtub. Really, anything you need to demonstrate that you know each skill a home health aide may need. Your pretend client will most likely be someone who volunteers in the class. You will be working with a live person, though it could be a mannequin as well. Treat this person as you would an actual client and speak to them accordingly. No fooling around. Please remember, you will be performing the actual skill required, not just explaining it to the instructor. If you're asked to help a patient out of her bed, then you will assist the volunteer patient out of the bed as you were trained. The major components of the skill set test include vital signs, meal planning, bathing and personal care, bed making, first aid, transferring client. Here are some general instructions for the skills test. When you're called into the testing room, the instructor will ask to see your identification and show you around the room, so you can see the supplies and equipment needed for the test. While you perform the skills, an instructor will observe and record your performance. The skills will be performed either on a candidate playing the part of the client or on a mannequin. You should treat and speak to the actor as if she's a real client. Before you take your test, the instructor will give you a card that has the list of skills you are to perform for your test with instructions for each skill. Make sure you read the instructions for each skill. An interpreter will assist if you're taking a non-English test. These are a few points to keep in mind while you take the skills test. You must perform the skills. Read the instructions carefully for each skill. When you finish a skill, say, "I'm done." If you think you made a mistake during a skill, you must tell the instructor that you're going back to make a correction. When you finish the last skill, treat it as though you're finished caring for the client for the day. The instructor is not allowed to help or teach you. There are no breaks provided. Your test will be ended if your behavior is rude or disruptive. You will have a chance to ask questions about the instructions after the instructor gives you an orientation to the testing room. Make sure you plan accordingly for test day. Please show up on time. That means about 30 minutes before you're scheduled to be tested. Find out where you're going and map out a route if needed. Not sure the best way to get there? Give the testing center a call. May be well worth it to call anyway in case something's changed. Make sure you bring these items with you: completed application, proof of completed home health aide training, 2 forms of identification, social security number, pencils, exam fees, bring a couple of personal checks just in case. Smartphones and other electronic devices are not allowed. Even if they are allowed in the testing area, they need to be turned off. Do not count on a personal storage area to store such items. And please, no personal belongings will be allowed. Just common sense, really. In summary, there are no secret words or rituals that a home health aide candidate can do to ace the test. It's a process to determine how much you know about taking care of folks in their home. Don't you want to be the best and be qualified? Stay positive, as this will go a long way. Your mindset affects the way you perform. If things get frustrating, take a deep breath and remember how intelligent you are. It will keep you in the mindset to attack the test, which is the mindset that is most effective. You can do this. You've made it this far. What about the exam results? Usually your results will be sent to the respective Department of Health or Nurse Registry in your state. You become a certified home health aide only after you meet all the requirements, including, of course, the competency test. While each state varies on how they share the results with you, typically students will be sent results of the test within a couple of weeks. The letter will indicate the exam results and any criminal background and drug testing results as well. If applicable, your results will be sent to the state nursing board or other governing body of medical professionals in the state. When you receive your test results, this does not necessarily mean you start working right away. Your employer will need to verify your results and make sure all the forms and application are in order. Once they've determined all is complete, they will give the go-ahead to start working as a home health aide.